Good evening, everyone. My name is Yan-Ru Song, and I am a fellow research doctor of Chang'an Memorial Hospital. It is my pleasure to be here and share the following clinical cases. Case 1 is a 32 years old nulliparous female suffering from secondary infertility for about 3 years. She has underlying disease of adenomyosis, which is the main contributor of her female factor infertility. Her partner has bilateral varicocele that were treated with varicocelectomy. She first came to our outpatient clinical in 2015. Sonography and lab data then revealed adenomyosis. So medical treatment with GnRH agonist was given for 2 months. Unfortunately, her OPD follow-ups afterwards did not show much improvement. So after through discussion with the patient, she decided to undergo surgical intervention. After her laparotomy adenomyotomy by Osada Mather, her CA125 level returned to that of normal range. Therefore, after taking oral pill for 2 more months, she started her IVF cycle. 16 oocytes were obtained via GnRH antagonist protocol. Endometrium preparation with artificial cycle were implemented with exogenous estradiol and progesterone. After embryo transfer, she successfully became pregnant and delivered at 33 weeks of gestation due to preterm labor. The diagram below summarizes the step of her IVF cycle. Our second case is a 32 years old primigravida female suffering from primary infertility for about 3 years due to adenomyosis and endometrioma. Her sonography and tumor marker back in 2016 were compatible with adenomyosis. Having failed IUI twice, she started her IVF cycle in February of 2017. 13 oocytes were obtained via GnRH antagonist protocol. GnRH agonist and oral pill were then prescribed for 2 months each for treatment of her adenomyosis. When her CA125 has returned to normal range after serious OPD follow-ups, we started her endometrium preparation with artificial cycle. However, after transferring 2 embryos, neither implant successfully. Therefore, we shift her treatment to Dynogest for many months until CA125 fell within normal range. This time, after transferring another 2 embryos, she successfully conceived and delivered at 36 weeks of gestation. The last case is a 37 years old primigravida female suffering from primary infertility for 5 years due to adenomyosis. Her symptom, lab, and image finding were all consistent for adenomyosis. She received GnRH agonist for a month. However, due to persistent symptom and image findings, she underwent HIFU and obtained a non-perfusion area of 96%. Contraception was advised for about 6 months. Afterward, she became pregnant via IVF and is expected to deliver this December. Thank you.